and lymph nodes and aching joints could be consistent with the condition.
And there are some people who develop sort of a prolonged illness where they really have profound fatigue afterwards.
At that point in time, there really was no treatment for Epstein-Barr.
I'd like to do some lifestyle changes, some diet changes.
Inflammation of the sacroiliac joint is one of the hallmark findings of ankylosing spondylitis. Ankylosing spondylitis is an inflammatory type of arthritis that involves the spine, but can involve other joints as well.
As seen in Jude's x-rays, it can cause swelling of the sacroiliac joint, the space between the spine and pelvis.
Right now, it's just a preliminary finding. It's not a definite diagnosis.
Ankylosing spondylitis is what they said at the time, but frankly, they didn't seem to me to be sure of that diagnosis.
The only indication that Jude has ankylosing spondylitis are her x-rays. Jude's blood work, however, is atypical for the condition.
Your labs are back. They're not showing anything abnormal.
Her labs at that time were really unremarkable. Nothing striking, wasn't anemic, didn't have a high white count. The tests that go along with rheumatoid arthritis in the blood were negative.
Jude's symptoms also lead Dr. HANNA to rule out Jude's previous diagnosis of the Epstein-Barr virus.
So it was a mystery as to what she had, but she did appear to have sacroiliitis.
I still think that right now the closest diagnosis is the ankylosing spondylitis.
Fortunately, if Jude does have a form of arthritis, her condition is not a serious one.
Even if it is ankylosing spondylitis, patients can do very well.
Jude, however, is devastated by the possible diagnosis.
I didn't think that Jude was a hypochondriac because she did have definite findings. Obviously, she wasn't faking fever, and the rash was real, felt hot, inflamed. She was very fatigued.
Off and on for over a decade.
You think of a number of potential etiologies.
It was very mysterious. Dr. HANNA called in a number of specialists.
Hi, Doctor. Miriam Hanna here. I'm going to need a consult.
Among the first to be called in is an infection.
They're a check. Thank you.
We did testing for multiple infectious etiologies, bacterial, viral, parasitic.
These will all come back negative?
Every single one of them.
And during the course of the hospitalization, the fevers persisted. She would typically spike during the course of a day. The fever would subside, only to reappear the next day. We did a CT scan, a CAT scan of her abdomen that did show some enlargement of the liver and spleen.
I think I've got the answer. Look, we've got the...
For almost a decade.
Adult onset stills is sort of a diagnosis of exclusion, meaning that you have to figure out everything else that isn't a possibility. And Jude had several of the typical features of adult stills, including the high spiking fevers, the rash, the liver function abnormalities, and the joint involvement.
When I finally got this I've had with this illness, with everything that it's taught me, and I feel really lucky to be alive and well. So, came and went.
Ankylosing spondylitis is an inflammatory type of arthritis that involves the spine, but can involve other joints as well.